Thank you, Mr. Chairman. I have more of a statement than anything else. My mother is 90 years old as of August 1st, retired oncology nurse. And she has been an advocate of medical marijuana since the 70s, having seen so many patients of hers not die of cancer, but die of the lack of nutrition, the lack of the inability to hold down the nutrients. My own sister 5 years ago died of liver cancer, and she died due to the nutritional aspects of it. And we know that when it comes to cancer, they rarely die of the cancer. It has to do with the implications of the chemo that they're receiving or other treatments. And what I've seen growing up is that there's been a demonization of marijuana in general. And that has spread over to the demonization of medical marijuana, which is a shame. And I have to ask myself the question as we go through and look at the society, why that's happened is, and I can't help but look at Big Pharma doesn't necessarily want this to happen. That they're not geared for this. They want to stick with what they make in regard to chronic pain, anxiety. I also have to look at law enforcement that they're scared that if a primary job that they have is to seek and find marijuana, is there going to be losses of jobs due to that aspect not being needed anymore, which I think we just said here, that's not going to be the situation. We're always going to have drugs out there, and you're always going to have individuals who are going to try to sneak by the process and grow recreational marijuana as opposed to medical marijuana. And then we also have the aspect when it comes down to social workers. Any of those who practice in the area of law, if you get caught on a DUI-1, first thing they do is they send you to treatment. And if that has to do with marijuana, of course, driving under the influence it's not just alcohol, it's marijuana. So there's also a fear that there will be lack and loss of jobs in that aspect, and I don't think that's going to happen at all. And I totally agree. It's time. It's time that we have this resource. I know so many people that don't want to be medicated by chemicals. They want to be medicated by something that's organic, that's grown from the ground, that our forefathers used years and years and years ago to treat symptoms for pain and other ailments. Thank you.
Thank you.